All right, good deal.
We don't even have to take that long.
Okay.
But I'm free for 30 minutes as well.
Okay. All right.
We're all
Thank
good.
you.
So, dude, your book is mind blowing.
Well, I appreciate that, especially coming from you, Brady. I really appreciate that, my friend.
Well, thank you. That's nice to say. It's funny because it's stuff that I've been saying for years and stuff that I learned from you. And frankly, I would have put it in writing before you did,
Yep.
but I didn't. And here it is. And there's a lot of things I meant to grab it on my way out the door this morning, so I could there was a couple things in there that I wanted to reference.
That might be it.
I'm sure you have a few copies of those laying around.
I do. Yeah.
So cool. Well, what I love doing with this, Andy, is I love just talking about specific patients, not sharing, personal information, but just telling the stories about the people that we've helped and how we've done it, et cetera. And, I think I'll go ahead and kick it off. And
okay.
I can't believe I didn't start this by talking about my wife.
Okay.
She is, well, long story short, the hottest girl at the gym fell for me. And when we first started, we weren't dating yet. We were just kind of like that flirting stage, right? I stalked her on social media, and she was complaining. So when we were at the gym, so we'd go to the gym at like 5 o'clock in the morning, right?
Right.
And she was complaining about these headaches and about being tired, and I stalked her on social media, and I saw some of the things that she was eating. Going to breakfast with her kids and having French toast, and just it was the standard American diet stuff. And
yeah.
I talked to her a little bit more about it, and she's like, I've got lupus. I'm a single mother working 2 jobs. I've got 4 kids. This is why I'm tired and I'm run down. I was like, well, I can help you. And
right.
She's like, whatever, you're a chiropractor. What are you doing?
Right. Oh yeah.
The smartest thing she did, she actually went to her dad flew her over to Boise to see, the expert rheumatologist who basically just wanted to put her on medications. The smartest thing she did, I think, said no. Anyway, time goes on, and then I actually introduced her. I actually made a challenge to several people there at the gym to follow the dietary protocols that I'd come up with, which are very similar to the ones that you have in your book. And she's always down for a challenge. So she took the challenge and cut gluten out of her life and cut dairy out of her life. And here we are 4 years later. And she still has those things like completely eliminated from her life. And she no longer has her kids would tease her because her ankles would swell, and they'd call it elephantitis because they would just balloon up. And she's a tiny girl. I mean, she's 5'4", 120 pounds on a wet day. But her ankles would just get ginormously huge, and then she'd have these like debilitating headaches. None of that has manifested itself since then. Now she still has little flare-ups of lupus here and there. Like if you look real close at the base of her neck, you can see a little bit of a rash. If she doesn't have makeup on, you can see a little bit of the classic butterfly rash. But most of her autoimmune issues are completely gone just from making those little dietary changes. And people are shocked when they actually find out that she has lupus. She started a whole Instagram page called Living with Lupus, just because so many people were asking, well, what do you do? How, why are you not on any medications? How are you managing this? It's 100% manageable if you are the one that's willing to take responsibility.
Right.
Yes, my sister, of course, is the first one commenting. Yes, she is a rock star. Jen knows this. Well, here she is right here on my desk, right?
Yeah.
So, and that was all just through diet. And I want to talk a little bit about the chapter you had in there about gluten. I think we should visit that for a few minutes.
Okay.
I'm in 100% agreement with you. The top 3 most inflammatory foods that you can eat are gluten, that protein that's found in wheat. Casein is one of the ones in protein. There's in milk. There's a couple of others that are in there that can be inflammatory, but casein is definitely number 1. And then sugar. You can eliminate those from your what? Let me rephrase that. When you eliminate those from your life, stand back.
Right. And if I might might add, if someone has any neurological deficit from ADD, ADHD, autism, vertigo, peripheral neuropathy, dementia, MS, Parkinson, okay, any of
Chronic
these,
pain.
and just look at the relationship between, just put that in what you've been diagnosed with and gluten sensitivity. All right. And if it's a brain-based disorder or neurological, there's a direct link to that. Okay. It's not, here's the thing, Brady. There's no question in the scientific literature that there's a link to that. So what it's saying is cause and effect, meaning when you eat this, bad things are going to happen. And then some people will say, well, why do I have joint pain or arthritis and this other person has lupus and this other person has dementia or ADHD? The weakest link in the chain, think of it like this: the weakest little kid in the playground is the one that gets picked on. All right. And it's the same way in our body. The weakest link, okay, we know the analogy, the weakest link, the chain's only as strong as its weakest link. And wherever the weak link is neurologically or in your body, when that autoimmune system attacks, the weakest link is going to show rear its ugly head first. And see, in our brain, as you well know, but I want to share this with people. In our brain, we don't have nerve endings, which means pain fibers. We have pain in our joints, our skin. So if it's damaged, we have pain. When our brain is damaged due to gluten sensitivity, anemia, blood sugar dysregulation, focus, attention, and concentration are the symptoms of an inflammatory brain. Just like in our body, it's joint. And depression is another big one. And I ask patients all the time who come in with depression, I'm like, why are you depressed? Because what I'm trying to figure out here is, did we have a severe emotional trauma, a car wreck, a death in the family, a loss of a loved one, a loss of a child? Do we have something recently that's been directly linked to that? And you know what I almost always hear? No. And I'm like, well, why are you depressed? And they're like, I don't really know. Yeah. And see, this in neuroscience, depression is directly linked to the frontal lobe. And then what's going to destroy that? Gluten. I was given a webinar, I don't know, a while back, and it was live, and somebody lost their mind on there, and it's like, oh my God, this doctor doesn't know what he's talking about, gluten. And I'm like, okay, I mean, I don't even know how to respond to these things. It's like me telling someone that the world is round and they believe that it's flat. You can't, the conversation is going to deteriorate quickly after that.
Right. And the problem is these people, and there's my Jenny just made a comment that we need to talk about here shortly.
Okay.
But the problem is you get on here and you start talking about these issues about gluten being related to brain, and people literally do lose their minds because they're so dang addicted to this stuff. Did you see that language control I just practiced there? They're so dang addicted to the stuff that when you tell them that, yeah, this needs to be eliminated, it's like you just shot their dog.
Because that's exactly what I explain to patients. And is if I tell you that you have to get off bread or pasta and there's an emotional response to that, I already know that you have an autoimmune attack to that. Because see, no one should have an affinity toward food. Of course, we want to eat food. We have to eat food to survive. Right. But no one should be like appalled due to the fact that we have to remove bread from their diet. And just so people will know, is gluten, what it's going to do, since it's hybridized and you don't have enzymes to break it down, then you've got these tight junctions in our gut that actually, think of it like a sledgehammer, pounding into that, and then you finally breach this barrier and it gets into your bloodstream. Now you have undigested proteins in your bloodstream, and now you launch an immune response to that and an autoimmune response to that. And then once it crosses the blood-brain barrier, this is where, if you will, the fun starts, because you have these little warriors in there called microglial cells that's actually there to actually protect your brain. But when these things get turned on, it's very difficult to turn them off. And so you have these people that are eating gluten from the time they come off their mom's milk into. And then 30 years later, these people come into the clinic with compulsive disorders, depression, anxiety, constipation, brain fog, focus, attention, and concentration.
Right.
And then, as you well know, when gluten and casein crosses the blood-brain barrier, which is not supposed to be able to do that if you're in health, then it turns into casomorphine and gluteomorphine, and it actually docks into a part of your brain where opioids dock for your reward center. So that's why people get an emotional response when you go, you got to stop eating bread, and they're like, oh my goodness, because there's an addiction to it, as you well know.
I can't do that. My grandma would be offended if I don't eat her rolls. So my sister, this is perfect because Jenny pipes in and she says, I know getting all of that out of my diet eliminated the brain fog. And if I can, let me see if I can find a picture real fast. So basically what happened with her was all of that food was creating all that inflammation, was blowing apart not just her gut blood barrier and her brain blood barrier, but it was those tight junctions in your gut are very similar to the tight junctions that are in your brain. So when those get separated, those gliadin proteins get in there and start setting off those inflammatory pathways. But if you look at this picture of her, right? So on the,
that's like two different people.
It is totally two different people.
Yeah.
So yeah, she's lost, I think, 50 something pounds.
Yeah.
But this picture of her on this side, you can see the inflammation.
Yeah.
This picture on this side, that's a new human being. Like I can't repeat what I said to her yesterday when she sent me that picture, but it's completely a new human, and people just have a hard time wrapping their heads around this. Two more thoughts that I had as you were saying that is, number one, if your doctor is telling you that your condition is genetic, 99% of the time, that basically just means I don't know what's wrong with you.
Exactly.
Get out of my office.
I call it a cop-out, what I call it.
It is 100% a cop-out. Now, are there genetic components to this? You bet there is. Guess what? I have that HLA-DQ gene. You know what that means? That means that I'm predisposed to gluten sensitivity.
That's right. You eat gluten. That's right.
On down the road, okay? And that's in your book. You talk about the Enterolab test. That's how I know that I have that gene. So the other thing I wanted to mention too is it's not just the gluten part of this. There is very much a component of it where the glyphosate, the Roundup that they spray on the wheat before it's shipped off and consumed, it actually will disrupt the microbiota in your gut. And as a result of that, they stop producing serotonin. So there's another very direct depression link to that.
Absolutely. And so and again, it's one of the things that I would want to stress to people. And I have a friend that he is solely convinced, because his doctor ran a gluten test and they tested for alpha-gliadin, that his son does not have a gluten sensitivity problem. And again, that if you're just testing for alpha-gliadin, that's like one of, I forget the exact number, but it's about 17 possible areas that this gluten sensitivity can actually trigger an autoimmune response. And this just testing alpha-gliadin, again, that's antiquated, outdated tests. So you've got to get, like I said, we want this 2020 technology in our phone and our computer and in our car, but we're just satisfied with 1980s and 1990s technology in healthcare. And it's like, and see, the doctors, see what I want patients to understand. If the doctor ran an antiquated, outdated test, the doctor's not affected by this.
Right.
You are. Okay. So just go and get the Enterolab test and change your life.
What does that Enterolab test cost? It's been so long. So
if you get the panel A2, which would be life-changing for people, is $369.
Right. And Cyrex Array 3 is about the same.
Possibly. My staff keeps up with all of that. I just happened to look up A2, but again, what I like about the Enterolab test, Brady, is because anybody watching this today can go to enterolab.com and order this test. You do not have to be a doctor to order this test. With Cyrex, you do have to be a doctor to do this, and you can get these results back. It's going to tell you whether or not you carry the gene for gluten sensitivity or celiac. And then you're going to do a poopy test, and it's going to tell you if these genes have actually if it's been turned on. Plus soy, milk, eggs, and And see, all of these have to be eliminated because and you've had this happen to you just like I have with me. The patients will come in and they'll say, well, I got off gluten and it didn't really make that big of an impact. Well, first of all, were you 100% on board?
Right.
It's like being pregnant. You can't be 99, you can't be 1% pregnant. You either are or you're not. And so you have to be 100%. And then on top of that, you may have had not just gluten, but you may have a casein autoimmune disorder, eggs. And see, if you're just eliminating one, that's why we have to do the test, because if you're just eliminating one of those and you have 3 problems, yeah, you're probably still going to you're not going to see much of an impact just by eliminating one. Now, is gluten is that a heavy hitter? Absolutely.
Right.
But this is why you have to do the test, because some kid can't come in with ADD or ADHD, and then the mom gets them off gluten because they didn't do the test. And they go, well, we tried that for 3 weeks and it didn't work. Well, okay, well, did we look at eggs and soy and milk? And no, we didn't do that. So anyway, we have to look at this whole picture. And so, and again, you get one of the things that's important with gluten, not only is that leads to a high carb diet, which that's a whole nother ball game for neurodegeneration there, because you got people you got inflammatory responses from gluten, you got an autoimmune response to gluten, which mainly is going to attack our cerebellum, our thyroid, and the myelin sheath. And then we got this blood sugar dysregulation. It's like a roller coaster ride. And then we have an entirely different set of disorders because of that. And see, this is one thing that I want people to understand too, is see, when you have insulin resistance, to get these neurotransmitters, to get the substrate, the brain has to make its own neurotransmitters. So you have to have this substrate, this formula, and you have to transport that across the blood-brain barrier. And the problem is, when a person is insulin resistant, you can't get the correct amino acid sequence across the blood-brain barrier for the brain to actually make serotonin and acetylcholine and dopamine. And so now acetylcholine, has to do with learning and memory.
Mm-hmm.
And then you got your serotonin, which is happiness and joy. Then you got your dopamine, which is pleasure and reward. So see, we've got all of these. Insulin resistant again is affecting that. So you start adding gluten sensitivity, inflammatory responses, and a roller coaster ride with blood sugar, and we almost have a perfect recipe here. And all we have to do now is just add stress and a sedentary lifestyle, and we have a perfect recipe here for toxic soup, which is the perfect recipe to destroy brain function and your body function.
People, it drives me nuts that people just don't think like we do, Andy.
Yeah. Well, because what happens is patients sometimes, and we have to retrain their thinking, because they've been so brainwashed, like sheeple, if you will, that my life is not my responsibility. I'm gonna plop myself down in the chair, and the doctor's gonna do his little thing, and then he's going to give me a prescription, and I'm going to go on about my life. Right. And then you wonder why 5, 10, 15, 20 years of that, now somebody is 40, 50, 60 years old, and they can't focus, they can't hold down a job, they can't maintain relationships, they can't socially act appropriately, because what's happening is this whole time our frontal lobe is just tanking, and then we add more to anxiety and depression, and so I tell people this all the time, and I don't know where I learned this, but it's a great statement. And nobody is ever going to care more for your brain than you do. And right. If you don't care, you've got to take control of that. You have to say, look, something is wrong. I mean, people can Google, get on the internet. There are people out here, doctors, that can help you. Okay. Now, they may not be the doctors you thought were supposed to help you, but that's your problem. Okay. Right. Because Brady I study and I go to school, and I got into chiropractic when I was 26, and then I got my functional neurology and my fellowship a few years after that. But I'm 56 now, and I swear I have never stopped studying, because, when I take it on as a badge of honor when I change people's lives that nobody else can. But again, people have to want their lives changed, and they have to do more than give it lip service. They have to take action into doing that. So There is help. If there's not help, I mean, I know that you're the same way, Brady. I mean, if somebody goes beyond where we can help them, I tell them, like, if you look at Alzheimer's, people can Google this, 7 stages of Alzheimer's. Once you get into stage 5, at that point, you're probably at the point of no return. All right. So anybody that's up to stage 5, we should be able to make, if they follow the program, some drastic improvements. And we were talking about war stories. I'm going to share one with you that just happened probably within the last month. I had a patient come into the clinic. He's 40 years old in a wheelchair. His mom is a nurse practitioner. He saw me on TV on one of my TV commercials, and he goes, "Look, nobody's able to help me. I want to go see Dr. Barlow, and I want to see what he can do. Why are all these people on TV giving all of these testimonials?" And my thing is, we don't see in my area, I don't see anybody, medical doctor, anybody with people getting on there giving multiple testimonials about the results they've gotten. Okay. And there's probably a reason for that. All right. But nevertheless, I'm on there with testimonials. So he comes in, wheelchair. He's got GERD. Nobody's even addressed it except here, take some medication for that. And so I'm like, okay, right out of the gate, you probably have an autoimmune disorder. And we do the test, the Cyrex ray number 5, man, and this thing is riddled with autoimmune disorders. And then blood work, I can't remember what his blood work was like. But anyway, we get him off gluten. We get his blood sugar regulated. We do his detox program, and the guy within 4 weeks is already out of a wheelchair and walking on a 4-prong walker. And I asked him when he sat in there the first day of the exam, I said, "What are the goals here?" And he goes, "I just want to get out of this wheelchair." So within 4 weeks, he's already out of the wheelchair, walking in the clinic on the walker. And it's like I've told doctors before, he'll end up with, hopefully we'll get him on crutches, then we'll get him on a walking cane, and then we'll get him to where he can walk on his own. But again, this guy finally came to the conclusion. It's like, look, no one is helping me.
Right.
And I have to look at a different avenue because, again, I'll use this as an example. I love this movie. It's a Memphis classic. It's from the movie The Firm. Tom Cruise was in it. Awesome movie. But there's one part of that movie that just kind of stuck out with me. Tom, the character that he had, and his brother's name was Ray. So he goes to visit Ray in jail. And Ray says, "Hey, is mom still seeing the same guy?" And he goes, "Ray, it's always the same guy." All right. So my point here is, even though you may be going to different doctors, okay, are they the same doctor? Are they giving you the same answers? And if you do, you've got to break that cycle, because nobody else is going to break that cycle for you. And again, you have the internet. I've written a book. I mean, I've got a step-by-step simple template here that people can follow that can change their life, but you've got to want it changed, and you've got to take the actions to make it happen. I can't do it for you. Brady can't do it for you.
Nope. You can only do that yourself. Not only
that's it.
Shift.
It's all we are is, I'm a vehicle to give people their life back. But I'm not going to come to your house. I'm not going to cook your dinner. I'm not going to go in the refrigerator to make sure that your pantry to make sure everything's gluten free. All I can do is show you how I've done it and how it's changed my life and my wife's life. I mean, Faye was having thyroid problems, and that's one of the reasons I went to all these, Apex seminars. Is because she kept, everybody kept running the same test, thyroid stimulating hormone. And then, that test has been out since 1965. And it's like, again, we want 2020 technology in our phone, but we're okay with 1965 technology in healthcare. Right. And then lo and behold, we find out, guess what? She's got Hashimoto's. And that's what's driving her autoimmune thyroid problem. And everybody else is trying to regulate her TSH. And so what happened is we decided that, look, these people don't know what they're doing, and I'm going to have to find this out on my own on how to solve this problem. And we did. And if you want it bad enough, and if you love your family or your wife or your husband or your kids, you will at some point step up and go, look, this doctor just doesn't obviously know what's going on. And I've got to look somewhere else, completely out of what people would consider mainstream media, to help solve this problem.
They can't.
I'm sorry, I said mainstream media. I meant mainstream medicine.
Same thing. Let's be honest.
Yeah.
Don't even get me going on that because
I know, man.
30-minute time cap. I agree with 1,000% of everything that you said. So going back to Faye, I just want to point out. Oh, by the way, I love you, Faye. I miss you. So she had Hashimoto's disease, which is an autoimmune attack on the thyroid, which happens to be carried on that same gene that I referenced earlier, that HLA-DQ gene that I've got. So it is in your book. You talk about the gluten protein in your immune system histologically cannot tell the difference between that and your thyroid. Point is if you are still eating gluten and you have a thyroid problem, you need to stop.
Yeah.
So anyway, Andy, I appreciate your time as always.
Yeah, Brady. Absolutely, my friend.
I think between, even if it is just me and my sister that are gaining from this, we've had several people come on knowing we'll get this thing to the point where people are actually asking questions. That would be really cool. So, but for now, hope you had an awesome Thanksgiving.
Thank you. You too, Brady. And we'll be talking soon. And I've got to head to the racquetball court and get a few games in the day.
Thank you, brother.
Appreciate you.
So, see you, brother.
Thank you.